You're watching Baptist Health's Resource Live, where our respected experts bring you timely and practical health and wellness information to improve your family's way of life. We're healthcare that cares. This is Resource Live.
Hello, everyone out there, and good afternoon. I'm Laurie Jennings, coming to you live from the Baptist Health Newsroom. February, as you may know, is American Heart Month, and we are continuing a series of heart discussions right here on Resource Live. We are wearing our red, at least I donned the red for you, because we've got to get in the mood to talk about our hearts, especially for the ladies. We are really focusing on women and heart disease today. As one of our most vital organs, our hearts, they work beat by beat, second by second, 24/7, never resting. Did you realize over the average lifetime, our hearts beat about 2.5 billion times? It's incredible. Heart disease is the leading cause of death in women of all ages, races, shapes, and sizes across the United States. But when women sometimes experience heart disease, it is very different than men. Heart disease refers to several types of heart conditions, including coronary artery disease and heart attack. We are so fortunate today to have an all-female panel of experts from Baptist Health joining us right here to really dive into the topic of heart disease in women. So let's welcome them all. Please welcome Dr. Eileen DeGrandis. She is the vascular surgeon and medical director of the Vein Clinic at the Christine E. Lynn Heart and Vascular Institute at Boca Raton Regional Hospital. And Dr. Sandra Chaparro, cardiologist at the Miami Cardiac and Vascular Institute. And thirdly, we have Gilda Green Lawrence. She is the nursing supervisor at the Miami Cardiac and Vascular Institute Structural Heart Program. Ladies, welcome to you all. Thank you for being here.
Thank you.
Thank you.
Before we dive into today's subject, I do want to remind our viewers, please send in your questions and comments throughout this segment. We are here for you, happy to answer any questions you have. I've gotten a few on Instagram. I can't wait to throw at the doctors here and our panel. So please keep them coming, because this is all about you and your questions about your heart. Dr. Chaparro, let me start with you. I was just teasing a little bit that I was racing here on the Palmetto, and just the stress of getting here alone, that's enough to get your heart racing, isn't it? And we really worry about women and stress. How frequent is heart disease in women right here in our country?
So it's important to emphasize that heart disease is the #1 cause of death in female patients in the United States. So 1 out of 5 patients will die from heart disease. So if you think about it, it kills more people than all the cancers combined. And unfortunately affects also in a higher number of circumstances in minorities like African-American patients.
So 1 in 5 women will die of heart disease. Those are incredible numbers. And Gilda, to you, chest pain, as we know, it's a telltale sign always of heart disease. But what other symptoms do women experience when they have some kind of heart condition?
Sure, of course. Other signs and symptoms would include dizziness, fatigue, shortness of breath, stomach pain. And when we talk about fatigue and shortness of breath, it's usually out of proportion to the activity that you're actually doing. It's a little bit more pronounced. So oftentimes women contribute the shortness of breath to their activity. So it's important to pay attention to the level of shortness of breath and fatigue as it relates to the activity that you're doing at the time.
But you say stomach pain. I would never imagine if I was having stomach pain that it would have anything to do with my heart.
Sure, and that's true. Oftentimes, it gets confused with, indigestion. Maybe you felt like you've eaten something bad and it didn't agree with you, and it should be cluing you in on that something else is going on other than your actual stomach.
And then Dr. Chaparro, what are the risk factors for heart disease? Are there a lot of some kind of non-traditional heart risk factors that are really just honed in on women?
Let's emphasize that they are the traditional risk factors that were studied initially in male patients because they were the ones who were participating in the clinical trials. So those are like the high blood pressure, the high cholesterol, the obese patient, the diabetes, the smoking, the inactive patient. So those are the traditional risk factors. But in female patients, we have non-traditional cardiovascular risk factors because we are different. So for example, gestational diabetes, having diabetes during pregnancies, or hypertension during pregnancies. Some types of the autoimmune diseases, some of the breast cancer treatments can predispose you to cardiovascular disease and depression.
Oh. And I want to get back to that, but I do want to ask Dr. DeGrandis, how, most importantly, can women reduce their risk of heart disease?
There are many ways women can reduce their risk of heart disease. Maintaining a healthy weight, and if you're overweight, even a moderate amount of weight loss, something as simple as 5 to 10 pounds, is a great place to start. Exercise regularly, good cardiovascular exercise, walking, simply walking 30 minutes a day can help your heart. Having, of course, a healthy diet, low in saturated fats, high in fiber, low in processed sugars are really good. Obviously not smoking. Smoking is a great risk factor for cardiovascular disease. Don't start smoking if you're bored. Don't start smoking if you're stressed. And definitely maintaining a low stress level and managing stress, which is really hard for busy moms, older women. This pandemic has been terrible on your stress. And even the palmetto has been awful on your
It really does. And you think about it, I mean, that's where stress, to me as a woman, I feel like my stress would affect the heart the most. Do you find that, Gilda? Do you find the women that you come in as a nurse, when you see them first and foremost, are they usually talking about being stressed?
Absolutely. Absolutely. I mean, you know, women lead a very stressful life. I mean, we're mothers, we're working, we're wives. And a lot of times, you know, we contribute our, you know, our, should I say, not well-being to just sort of being stressed and not seeking, you know, the healthcare attention that we actually really need. So that's very important.
And Dr. DeGrandis, you were talking about living a healthy life,
Sure.
but how can, in this moment, especially with COVID and all the stressors and being at home, trying to work and exist in the house and be a homeschooler and everything else going on, what is the most important for women? How can they break away and calm their heart, if you will?
I think the most important thing is to really be conscious of it and take time, that 15 minutes a day where you have to lock yourself in the bathroom and turn on a TV show for your kids, or it's very much mindfulness of that your heart is racing too much, that you have too much on your plate, and just taking that time to think about it and relax and de-stress. I tell my patients very much when there is stress to take it one day at a time, one moment at a time. If you're very overwhelmed, it's okay to take a step back and just relax and think and reassess and regroup.
Sure.
I think little things help a lot, especially in a pandemic.
Because Dr. DeGrandis, you were pointing out that depression is actually a more modern day trigger for heart disease. And so many women are feeling anxiety and falling into depressions right now. How does that affect the heart?
I think significantly. I think one of the large concerns of depression is that people become demotivated. They start eating poorly. They start forgetting their medications. Again, it adds to stress and things snowball. It's also a great risk factor for self-neglect. People don't go to the hospital when they're supposed to, when they're not feeling well. People forget to take their blood pressure medications or see their doctors regularly. And these are significant risk factors for cardiovascular disease worsening, especially if you're predisposed.
And Dr. Chaparro, chime in on that with us a little bit. How can we get the word out to women that they really have to deal with their anxiety and their depression, or they're going to be getting into some heart troubles?
So it's important to emphasize that you should continue seeing your provider on a regular basis, even during the pandemic. You know, if you don't have time for you, who's going to take care of your kids and the family when you're not around? So you have to prioritize yourself. And then again, is knowing your numbers. So knowing what's your cholesterol number, knowing what's your blood pressure number, what's your diabetes. If you have diabetes, what's your glucose level. All these things are pretty important. Checking your weight. I know that we don't like to go and check our weight daily, but it's really important because these are the numbers that are telling you if you are a higher risk. The more risk factors, the higher the risk for cardiovascular disease. So yes, you should prioritize your life.
And so many people are afraid to go to the doctor right now, so they may not even be monitoring themselves. Do you encourage your patients to use a wearable, or how do you tell them to monitor?
Absolutely. And now we have telemedicine, so you don't have to get out of the house. You don't have to spend extra time traveling to see your doctor. You can do it with the convenience of your iPhone or your Android. So there's no excuse really to go and see your provider.
But Dr. DeGrandis, if you were looking at me now on a telemedicine, would you be able to see signs of heart disease if I had them? Or is it up to me to provide you with the numbers, the BP and the weight, and et cetera?
Well, sometimes I can see when patients don't look well. It's what the providers like to call an eyeball test.
Right.
Sometimes people with heart disease or heart failure will be very swollen. They'll be short of breath. They'll be uncomfortable speaking. And sometimes it's just targeted questions like, how are you feeling? Are you tired all the time? What's your energy level like? Are you more tired than you are normal? So there's some things that there's just simple questions of like, how are you doing today? That can really elicit quite a good amount of information about your heart. But there are some things I can tell just by looking at someone, yes.
Interesting. And Gilda, you must feel the same way. You're the nursing supervisor at the Miami Cardiovascular Institute. So you're the front line right there.
Sure.
What is your telltale sign that there's heart trouble?
Well, most of the time, fatigue. I notice patients that, they complain of a lot of fatigue, just sort of fatigue that's sort of out of proportion to just normal walking, shortness of breath, chest pain is a classic sign. And just overall, just not really feeling like they want to do much of anything. And they once lived a very full and active life, and then all of a sudden, they're just not really up to doing much.
And Dr. DeGrandis, I always heard as a newswoman that it was the arm. I thought it was the left arm, or is it the right? But I always heard that one symptom for women specifically was pain in the arm more than in the chest. Is that still true?
It can be. A lot of women present very atypically. I would agree with Gilda that a lot of symptoms I see are exhaustion, again, out of proportion, more so than the purported left arm weakness, tingling, or pain. Certainly we see it as well. Dr. Chaparro could probably answer more to that effect. I see, again, quite a bit of just feeling tired and out of sorts, more so than I see the classic pain with a heart attack.
Would you agree, Dr. Chaparro?
Yes, absolutely. We as women present completely different from men. We don't have the classical chest pain, the pressure in the chest. It's usually fatigue in a specific symptoms. Sometimes they end up doing workup of abdominal problems when the problem is the heart. So it's always important as a provider to think about cardiovascular disease when you're doing the differential.
Dr. Chaparro, I got a nice Instagram message today from a young woman named Nikki, and she said you helped her dad so much through his massive heart attack. She says he was 51 when he had the heart attack and a heart transplant at 66. She is 42. She wants to lower her risk. She tries to eat healthy, not smoke. She takes fish oil. She works out. But given her family history and the heart issues go far back on her dad's side, does she need to see a cardiologist or have any testing to try to prevent the same issues? And she is 42.
So without knowing her specific condition, it's important to know your numbers, go to your provider. It doesn't have to be a cardiologist. It can be a primary care physician. Get a sense of what's your cholesterol, how are your electrolytes, your kidney function. All these numbers are really important. You have to put that into context with the family history. So there are some cardiovascular diseases that, yes, they run in the family. But the majority, for example, the typical coronary artery disease is something that we can modify. So if we make lifestyle changes, we can decrease the risk by 80%. And so that's only for the cardiovascular risk that we can modify as the ones that we mentioned before. We cannot modify genetics, and so we cannot modify our age or our sex.
And it's really fascinating because I think, years ago, everyone just felt like if your parents had this or your grandparents, you were going to get it, period. And I think now in more modern times, we're realizing we really can take control of our health and we can turn some of this around with the proper eating and proper care in our bodies. Gilda, I wanted to ask you as the nursing supervisor, and again, the person who sees a lot of these patients right in the front lines, are there a lot of racial disparities in the numbers you see? Are there disproportionate rates of heart disease across the races?
Unfortunately, there are. African-American subgroups have a greater burden of myocardial infarctions, heart failure, stroke, and other cardiovascular diseases. And unfortunately, African-American females whose death rates from myocardial infarctions are actually higher than white females. And the deaths occur at an earlier age with patients who suffer from myocardial infarctions and other cardiovascular diseases, unfortunately.
Is there a lot of research going on into this, or where do they think this comes from?
Well, what is the issue and why is that occurring? Is that what you're asking?
Yes.
I think part of it is just like we mentioned earlier, there are certain risk factors that increase your risk for developing heart disease. And so I think that if we mitigate those risks, I think that the death rates from cardiovascular diseases would also be lower as well. So.
And Dr. DeGrandis, give us a little education on coronary artery disease for those who feel like that runs in their family. What is that exactly, and how does it affect women differently?
So coronary artery disease is plaque disease inside blood vessels that feed the muscles of the heart. And it's really important to pay attention to this, because if you get enough narrowing of the blood vessels inside to the heart muscles, you can cause the heart attacks, because your heart wants oxygen and nutrients from these blood vessels. If you're narrowing that and the added stressors in the use of the heart, it can cause the heart ischemia, because your heart muscle is essentially not getting the oxygen and nutrients it needs when these blood vessels are blocked. This can be affected significantly by diet and by genetics. Diet, especially high cholesterol diets, high fat diets, smoking can narrow these blood vessels. And these are all things that we would want you to see your cardiologist about if there's a family propensity to build plaque and build narrowings in the blood vessels. Some women have congenitally small blood vessels, and that's a problem we see more so in women than we do in men. So those vessels are more apt to narrow simply because of time and age. And these are things that we encourage women to see their blood vessel doctors and the cardiologists and their cardiac surgeons about sooner than men, because we are smaller, but we have the same disease burden, if not more.
And Dr. Chaparro, do more women die from coronary artery disease than men?
I think the proportion is similar. I think what is important is the age. And again, a lot of the studies were initially done in male patients and not female patients. So we have more data on the male presentations. We are more, the system is directed to identifying those patients more than the female patients. So I think that it's not necessarily just because of your sex, but yes, the male sex has a higher incidence of cardiovascular disease.
We've heard that for so many decades that always the studies are done on men. Do you feel like that's changing, Dr. Chaparro? Are there beginning to be more studies on women when it comes to heart disease?
So it's not just heart disease, but in all areas of medicine.
Right. Yes.
So, but yes, the incentive from, for example, the National Institute of Health is to support research that has a higher percentage of female patients.
Well, ladies, you can all chime in on this because we're going to talk menopause for a moment. The average age for menopause is 51. So does menopause affect your heart? Dr. Chaparro, can you start us on that one?
So menopause does not cause cardiovascular disease. Let's be clear about that.
Good.
The problem is that we, at that age, carry more risk factors for cardiovascular disease, but it's not the menopause the reason for it.
Okay. And Dr. DeGrandis, have you ever found any tie, or you just try to let women know around that age they need to be more aware?
I agree with Dr. Chaparro. I think women just need to be more aware that around that age, you're also associated with more age-related disease. More atherosclerotic disease develops as you get older. And as you get older, your blood vessels and your heart is a little bit less resilient to ischemia and a little bit less, you're not 20 anymore, you're less resilient to time.
And Gilda, when you see people come in, do they often think, oh, it's just menopause, or that my stomach pains and my depression and my fatigue, it must just be menopause?
Sure, sure. But then they come in and for the symptoms. So obviously they felt that it was something more than that to seek medical attention. But sure, they usually do attribute their signs and symptoms to something else.
And aspirin, I mean, I have to admit, most times I do have a little baby aspirin in my purse, and I think I'd still take it if I felt some kind of weird pain in my arm or chest. Is that still the way to go, Gilda?
Yes, that aspirin is definitely a well-established part of the treatment plan for patients with heart attack or stroke. However, I would like to caution you about taking aspirin or really any other medication as far as that is concerned without consulting your physician first. Because aspirin and the benefits and risk of aspirin vary from person to person. And so the patients could be on other medications that could potentially interact with aspirin. And so in those particular patients, aspirin's not recommended. So it's very important to have a conversation with your healthcare provider before initiating aspirin therapy.
And Dr. DeGrandis, how do you guide people with that? Because it's been around since the 70s. I know my mother still is like, oh, take an aspirin, take an aspirin. I say, Mom, we don't take aspirin anymore. That just doesn't happen. But is it good to just have in your purse as a lady?
I think it's one of the many things that many women have in their purses.
Plus the Q-tips and the combs and everything else, right?
Yes. I don't think it's a wrong thing to have in your purse, but I do strongly agree with Gilda that there are so many patients with many who take many medications, and in the age of polypharmacy, where there are a lot of drug interactions, and someone may already be on an aspirin-like medication, why would you double up or triple up? Because these things can certainly occur. Definitely very important to see a cardiologist or your primary care to review those medications before you start another one. I wouldn't start taking it willy-nilly. Definitely wouldn't take it because of anxiety, simply because you've heard that maybe it might be good. Definitely run it by your doctor.
Okay. And Dr. Chaparro, when you're trying to get the word across to women to really eat healthy and really take control of their heart health, how important is it to avoid the fatty foods, all the deep fried foods, a lot of the comfort food that everybody wants right now stuck at home?
You know, it's sometimes very convenient and easy to get access to that type of food, but not only for us, but for our family. We have to be role models for our kids to learn how to eat healthy. So we need to emphasize that you have to have a balanced diet. You don't really need to have a lot of supplements. You don't need to have extra vitamins. You just need to have balance with the normal fruits, vegetables, nuts, cereals. So again, avoid fat, avoid the extra meat that you don't need. And, you know, quantity is also very important. And so it's common sense. We're not telling you not to completely change everything, but just little by little, you can make significant changes. And again, be a role model for your family.
Because you see cases like this all the time, both you and Dr. DeGrandis, to you. I mean, is it just critical, especially with the coronary heart disease, to get across to women to bring down the fats and to exercise?
Yes, and exercise, something that some people don't find enough time to do that. So you can start with just 5 minutes a day. Doesn't require more than that. And little by little, you can add. There are multiple apps that you can download, and you can do a very good exercise slowly. If you have heart disease, you should consider cardiac rehabilitation, which is an exercise program that is directed by specialists, and then you can test your body under supervision. But exercise is one of the most important parts of cardiovascular disease prevention and treatment.
And so much of that is tied to cholesterol. And Dr. DeGrandis, so many women feel like well, maybe my good cholesterol is a little low, or my bad cholesterol is low, but my good cholesterol is so high, so I'm okay. But how do we know when is it a real concern about our cholesterol?
I think overall high numbers aren't good of the LDL. I think women especially really need to work on our HDL, our good cholesterol. I think heart disease is very much more associated with very low HDL levels than it is our LDL levels. So HDL is very hard to control. Some people have a genetic predisposition to having low HDL levels. And it's also a marker of activity. So people who exercise more have higher HDL levels. And as Dr. Chaparro said, it's very hard to start, but you can start simply just improving your exercise routine, 5 minutes a day. This, cardiac exercise, walking is a great exercise to help improve your HDL. Anything that improves the heart function.
And we do have a question coming in right here. Dr. Chaparro, to you, is there a way for people to check how much plaque is in their arteries?
It's a good question, and especially during the heart month, there are a lot of ways where you can do a calcium score, which is a CT scan. It's a non-invasive scan that if you have the risk factor, you can get a number, and based on that number, you can make modifications to your lifestyle, and sometimes you can be a candidate for statin therapy.
And Gilda, let me throw this one to you. How likely am I to develop heart disease if no one in my family has it? I bet you get that a lot.
Sure, but just because no one in your family has it doesn't give you a free pass not to do all the things to mitigate your risk for developing heart disease. So the same thing applies to you. Exercise, weight reduction, eating a healthy diet, no smoking.
So true, and also generations ago, they didn't have the same kind of stressors that we have now. Exactly. So it really, you have to take control of yourself, even if it doesn't run in your family. Absolutely. Okay, Dr. DeGrandis, this one to you. It's coming in for us live. What is the latest information on how long a patient should be on blood thinners after getting a stent?
So it depends on the type of the stent. And I think Dr. Chaparro can answer this as well, because she sees this in our cardiology office.
Sure.
It really depends on how many stents we place and the patient's other risk factors. We have what we call bare metal stents, which are not covered, and we have covered stents. The time and duration of blood thinners really varies by the patient's needs. We have what we call antiplatelet therapy, which is like aspirin and Plavix. We have anticoagulants like Coumadin and Eliquis and Xarelto. So there is never one easy or simple answer to this. It may be as short of a duration as 3 months. It may be years.
Is there a kind of a final thought, Dr. Chaparro, that you'd like to leave our viewers with?
Yes, so again, you have the power to make some lifestyle changes and control some of the numbers. Some of the risk factors you can control, but something to add to what we just said, is important also to get vaccinated, because vaccines will decrease your risk of mortality. Remember that cardiovascular disease is a risk factor for example, influenza or COVID-19. So a vaccine is an important tool to decrease your chances of dying.
Interesting. All right. And Gilda, what is your final advice to women out there?
I would say my final advice to women out there is to sort of pay attention to your symptoms and don't dismiss them, don't discount them. And if you're feeling that way, I would suggest writing it down, write all your questions down, because most of the time you'll come to the doctor's office and you forget how you're feeling. There's a time constraint there. You may be nervous, and you forget the questions that you really want to ask. So I cannot stress enough, write it down, be true to yourself. And if you don't get the answers that you need, you get a second opinion so that you're always feeling comfortable, because you know yourself, and be confident in that.
Especially these days, if you're going to make the time to get to the doctor in person, really utilize that time. Have your
Exactly.
questions ready on a piece of paper. And Dr. DeGrandis, let you say a final word to our viewers. What is the most important piece of this you'd like to leave with them?
I would like women to take care of themselves. Often as women, we are taking care of other people and we forget to take care of ourselves. So it's really important to take care of yourself, to know what you're feeling and know when you're not feeling well and ask for help. And always take that 15 minutes to reassess if you need it, to take a break if you need it, and just give yourself what you need.
And especially now that we're all home, if you were lucky enough to have a wonderful supportive spouse or partner, lean on them. I always find too, women, we all take it upon ourselves to do everything. And you just have to stop and think, how can my partner help me? How can my spouse help me? Maybe they can get this done. And we as women have to reach out for a little more help. I love that thought. Well, you have all been wonderful. Dr. DeGrandis, Dr. Chaparro, and Gilda, thank you so much. Gilda Green Lawrence, you have all been amazing. Thank you. And we're so glad you're part of the Baptist family to help women through heart disease. Thank you so much.
You're welcome.
And we want to remind you, our viewers, you can connect with us on our social media channels anytime. We are here on Facebook, Instagram, Twitter, and LinkedIn. And check out our resource blog for the latest news at baptisthealth.net/news. It's baptisthealth.net/news, because there's also a link to all the episodes of the Baptist Health Talk podcast as well. And I got a lot of DMs asking me, is this going to be recorded because I'm working? I said, yes, this will always live on the Baptist Health Facebook page, so everyone can learn from this during Heart Month. So on behalf of everyone here at Baptist Health, we ask you to please stay safe, take care of your heart, and live heart healthy, and do your best to stop the spread of COVID-19. We'll all mask up, South Florida, and we will see you back here again. I'm Laurie Jennings in the Baptist Health Newsroom. Stay safe and stay well.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Resource Live is brought to you by Baptist Health South Florida, healthcare that cares.